The shadow within. Navigating breast cancer recurrence, signs, monitoring, and treatment on HealthSphere. Welcome back to HealthSphere, where we explore vital health topics to empower you with knowledge. Today, we delve into a subject that touches the lives of many who have faced breast cancer: the possibility of recurrence. For patients, survivors, and caregivers, the fear of the cancer returning can be a persistent concern even after successful initial treatment. In our research for our documentary on breast cancer, we understand the importance of addressing this topic head-on. Knowledge is a powerful tool in navigating health challenges. This article aims to shed light on what breast cancer recurrence is, its signs to be aware of, how healthcare professionals monitor for it, and the strategies employed to treat it if it unfortunately returns. Understanding breast cancer recurrence. After initial treatment, breast cancer can sometimes return. This happens because a few microscopic cancer cells might have survived and remained undetected in the body. Over time, these cells can multiply, forming a new tumor. Recurrence doesn't mean the initial treatment failed. Cancer is complex. Recurrence can happen in a few ways. Local recurrence. The cancer returns in the same breast or on the chest wall near the original site. Regional recurrence. The cancer returns in nearby lymph nodes, like those in the armpit, above the collarbone, or near the breastbone. Distant recurrence. The cancer has spread to distant organs like bones, lungs, liver, or brain. This is metastatic breast cancer. The type of original cancer and the treatments received can influence the likelihood and pattern of recurrence. Living with the fear of recurrence. The fear of recurrence is a normal and valid feeling for many survivors. Acknowledging this fear and seeking support, whether through your healthcare team, support groups, or counseling, is an important part of survivorship. Understanding the monitoring process and potential signs can also help provide a sense of control. Recognizing the signs, what to look for. Being aware of potential signs is important, but remember many symptoms can have other causes. The key is to be vigilant about new, persistent, or unexplained changes and report them promptly to your doctor. Here are potential signs. Signs of local recurrence. A new lump or thickening in the breast or chest wall. Changes in the skin on or near the breast chest wall. Redness. Swelling, rash, thickening, dimpling, scaling, or ulceration. Nipple changes, inversion, scaling, redness, swelling, or discharge. Persistent pain in the breast or chest wall. Signs of regional recurrence. Swelling or a new lump in the armpit, above the collarbone, or in the neck. Signs of distant recurrence. Symptoms depend on where the cancer has spread. Bone, persistent bone pain, fractures, weakness, numbness in limbs. Lung, persistent cough, shortness of breath, chest pain. Liver, pain in upper right abdomen, fatigue, loss of appetite, weight loss, jaundice, abdominal swelling. Brain, persistent headaches, vision changes, numbness, weakness on one side, speech coordination issues, seizures, memory problems. Other, unexplained significant weight loss, severe fatigue, loss of appetite, general unwell feeling. Experiencing these symptoms doesn't guarantee recurrence, but they warrant prompt medical evaluation. Monitoring and surveillance. A structured follow-up plan after initial treatment helps monitor recovery and detect potential recurrence. This plan is tailored to your specific situation. Typical surveillance includes regular physical exams with your oncologist at scheduled intervals. Mammography. Annual mammograms of the remaining breast and the opposite breast. Discuss your follow-up schedule and tests with your oncologist. Diagnosing recurrence. If recurrence is suspected, further tests are done. Imaging scans based on the suspected location. Biopsy. A tissue sample is taken and examined. This confirms cancer and allows retesting of its characteristics, which is vital for treatment planning as these can change. Treatment strategies for recurring breast cancer. Treatment depends on the recurrence location, the cancer's characteristics, previous treatments, and your overall health. Local or regional recurrence. Treatment often aims for cure. This usually involves surgery to remove the tumor lymph nodes. often followed by radiation therapy and systemic therapy, to reduce risk elsewhere. Distant recurrence. The goal shifts to managing the disease long-term, controlling growth, managing symptoms, and maintaining quality of life. Treatment is primarily systemic therapy, hormone therapy. 4R plus, PR plus cancers, often combined with targeted drugs like CDK4/6 inhibitors. HER2 targeted therapy, 4HER to cancers, usually with chemotherapy. Chemotherapy, used for triple-negative cancers, or when other therapies are no longer effective for other subtypes. Targeted therapy, drugs targeting specific mutations or pathways are used based on the cancer's profile. Immunotherapy may be an option for some triple-negative cancers. Bond-targeted therapies, used if cancer is in the bones to strengthen them and prevent complications. Palliative care focuses on symptom relief and improving quality of life at any stage of metastatic disease.
Clinical trials
Offer access to promising new treatments and are an important option. Living with recurrence. Living with recurring cancer means focusing on holistic care, symptom management, maintaining emotional well-being. Staying connected to your support system and open communication with your healthcare team are crucial. Hope and progress. Significant advances in treating metastatic breast cancer mean it's increasingly managed as a chronic condition. New therapies are constantly improving outcomes and quality of life for many patients. Research continues tirelessly. Conclusion: vigilance and empowerment. Navigating the possibility of breast cancer recurrence is challenging. Knowledge empowers you. Understand the signs, follow your monitoring plan, and communicate openly with your doctor. If you have any new, persistent, or unexplained symptoms, contact your doctor. Prompt evaluation provides clarity and ensures timely care if needed. You are not alone. The HealthSphere community and various resources are here to support you. We are committed to bringing you information on this journey. Stay informed, stay proactive, and remember your resilience. Thank you for joining us on HealthSphere. Don't forget to subscribe for more vital health discussions. Disclaimer: this article provides general information and is not a substitute for professional medical advice. Always consult with your doctor for one diagnosis, treatment, and personalized recommendations.